Good morning. Myself, Dr. Ranajit Kar. Presently, I am working as the head of the department and senior consultant Department of Radiation Oncology in HCG Panda Cancer Hospital, Cuttack. We will discuss about cancer and cancer radiation therapy. So, abnormal madness of cell is called cancer. So, cancer has multi-modalities of treatment. So, multi-modalities like surgical oncology, radiation oncology, medical oncology, what I mean to say, hormone therapy, biotherapy, targeted therapy, immunotherapy. So all these are integral part of cancer treatment, the multimodality approach of cancer treatment. So radiation, my domain, radiation is required more or less 2/3 of the cases in every cancer. Not only all malignant diseases, but also in benign diseases, we require radiation therapy. So radiation, it's a integral part of cancer treatment. It's a modality of treatment of cancer. Radiation purpose is to decrease the local recurrences. सेम जगह पे बीमारी ना आने के लिए जो ट्रीटमेंट करते हैं उसको बोलते हैं रेडिएशन. सो रेडिएशन जो देते हैं वीकली 5 दिन देते हैं, मंडे, ट्यूसडे, वेडनेसडे, थर्सडे, फ्राइडे, 5 से 7 मिनट का इलाज है एंड सैटरडे संडे ऑफ रहता है. सो ये 6 हफ्ते से 7 हफ्ता चलता है. जब ये क्यूरेटिव इंटेंशन में हम रेडिएशन देते हैं तो 7 हफ्ता चलता है. जब ये पोस्ट ऑफ सर्जरी के बाद जो रेडिएशन देते हैं वो 6 हफ्ता चलता है. 30 फ्रैक्शन ऑफ रेडिएशन देते हैं. To decrease the bone pain, to decrease the pathological fracture, to decrease the bleeding, to decrease the maggots, to decrease the ulceration, to decrease the excruciating pain, what radiation we are giving, it is called palliative radiation. और वो 5 से 10 स्लाइड हम देते हैं हफ्ते में 5 दिन, 2 हफ्ते का इलाज. So radiation mainly brain tumor में each head and neck cancer like oral cavity, like what I mean to say, oral tongue, lips, buccal mucosa, then lower alveolus, floor of mouth, hard palate. In post-op setting, radical setting, we are giving radiation. Surgery is the mainstay of treatment. Post-surgery, we are giving radiation. In adjuvant setting, we are giving 28 to 30 fraction of radiation Monday to Friday, and Saturday, Sunday is off. And the pros and cons of radiation, or the myths and facts of radiation is like that. In each and every cases of radiation, what the patient is going on, the patient is taking the treatment. Each and every cases they don't require chemotherapy, simultaneous chemotherapy, concurrent chemotherapy. Like radiation they are taking in some setting like node positive, like in case of a perinodal extension positive. These are the pathological finding what we are observing in the histopathological reports. Then we have to decide whether we have to give the concurrent chemotherapy, simultaneous chemotherapy. So chemotherapy side effects like hair loss, weakness, nausea, vomiting, diarrhea, constipation, fever, anemia, thrombocytopenia, leukopenia. So radiation side effect like dryness of mouth, moistness of mouth, skin ulceration, blackening of skin, then xerostomia, loss of taste, then we cannot able to swallow, that is called odynophagia, difficulty in swallow, that is dysphagia. So these are the alopecia where the patient is going on treatment. Like in brain tumor, patient is taking the treatment for the brain tumor. So partial alopecia, loss of hair is called alopecia. In that case, alopecia is. So all these side effects are temporary, not permanent. The patient can reversile, patient can rejuvenate all these side effects of radiation within span of time. So side effect is up to 0 to 1.5 months. That is for the acute side effect. 1.5 months to 3 months. That is for the chronic side effect. 3 months to 6 months. That is for subacute side effect. 3 months to 6 months. That is chronic side effect. All these are side effects of radiation therapy. So what I mean to say, so radiation is not a contagious disease. Cancer is not a contagious disease. Cancer patient can take foods with his son, with his daughter, with his wife. They can sleep beside, and there is no side effect. There is no, what I mean to say, there is no, this is not a communicable disease. This is not a contagious disease. So all radiation patient, all radiation does not cause major toxicity. So the newer techniques of radiation like image guided radiation therapy, stereotactic radiosurgery, stereotactic body frame radiation therapy, intensity modulation radiation therapy, 3D conformal radiation therapy, all these don't have side effects, like very minimal side effect. So we can give maximum tumoricidal dose to the tumors, the cancerous cell, the malignant cell, and very minimal toxicity to the normal tissue. Like in case of bladder cancer treatment, there is like cystitis. In case of a cervical cancer patient, garbhaşay cancer patient, we have like rectal ulceration, rectal bleeding, then urinal bleeding. All these are side effects of radiation. So radiation is given in each and every malignant cases. 2/3 of the cases they require radiation therapy. So it is given in photons or it is given in electrons. Sometimes in case of a breast cancer tumor, breast conservation therapy, radiation therapy, post adjuvant external beam radiation therapy, we are giving electron beam radiation therapy to the tumor bed. So we need not to be panic. So radiation, the oncology domain has been the domain has been improved like anything. So very minimal side effect. The tumoricidal dose will be maximum, and the patient overall survival, disease-free survival, and progression-free survival is progression-free survival is too high in case of radiation treatment. So, like what I meant to say, it does not cause pain. So radiation treatment is not causing pain. So very minimal toxicity, like what I meant to say, odynophagia, dysphagia, then mucositis, mucosal ulceration, dryness of skin, skin ulceration, then blackening of skin. Each and everything is very dismal in case of a high conformal, high precision radiation therapy, high equipped radiation therapy. So true beam machine in HCG Panda Cancer Hospital, true beam machine, Electa machine, Versa HD, and variant Electa Versa HD, variant true beam machine is there, and we are giving short course radiation therapy, like in case of a cancer cervix, cancer endometrium. So we are giving intracavitary brachytherapy. Post external beam radiation therapy, we are giving 2 to 3 fraction of intracavitary brachytherapy, 7 grade to the 0.8, and once in a week treatment. So patient need not to worry. They can take the treatment within 6 weeks of, in case of a head and neck cancer. They can take the treatment 8 weeks in case of a cancer cervix or cancer endometrium, and it's purely curable disease. Nothing to be panic. Cancer is curable. Cancer can be treatable. Cancer can be manageable. Cancer can be preventable, but it should be detected in an early stage. So most of the cases, radiation-induced malignancy is occurring. Like in case of a lymphoma, this is a lymphoid malignancy. Post chemotherapy, what we are giving, it is called involved field radiation therapy, IF-30. Post IF-30, sometimes we are observing after 7 years there is a sarcoma, there is a soft tissue sarcoma in the mediastinum. So that is very rare. That is occurring in 1 to 7% of cases in whole of their time. So all these are myths and the facts of radiation treatment. Radiation treatment is costly. I agree fully. Like 3D therapy, it costs 1.5 lakh. IMRT, it costs almost 2 lakh. IGRT, it is cost 1.25 to 2.65 lakh. But in conformal techniques of radiation, in case of a cancer prostate, cancer penis, cancer, cancer bladder, retroperitoneal sarcoma, lymphoma, or head and neck cancer, IGRT for the lung cancer. So patient overall survival, disease-free survival, and progression-free survival is much more better than in conventional fractionation of radiation. So all should prefer high precision radiation therapy, conformal techniques of radiation therapy in their clinical practices. Thanks a lot for your patient. Thanks a lot.